The following is a Big Sioux Media production.
Good evening, ladies and gentlemen, and welcome to this edition of the People of Dell's podcast. Today we are so graciously accepting an invitation with Dr. Matt Herber. So, Dr. Herber, we'd like to thank you for joining us here on this podcast for Big Sioux Media.
You're welcome. You're welcome. Happy to do it.
So, we are sitting here towards the end of April 2020. COVID-19 is going on, and we're just going to touch briefly on that. What have you seen? What are you telling people as they're asking you questions about COVID-19, especially the difference between an allergy, the flu, and COVID?
It's really kind of evolving. I know here in small town South Dakota, feel like you're kind of isolated and it's not going to happen. But just like we know, just 20 miles away, it's getting a little bit crazy. So it's really hard to know because the symptoms really run the spectrum. Some people hardly have any symptoms at all, or it just seems like a mild cold, and then other people have the severe shortness of breath and end up being hospitalized and just do poorly. So the three big things right now that we're looking for are new development of cough, fever, shortness of breath. Those seem to be the most common things that can be the trigger that tells us that we have to be concerned. And of course, in healthy people, even if they have those symptoms, at this point in time, it's one of those things where we don't have enough tests to test everybody who has symptoms. So we're trying to be good stewards of our resources and using those tests for the more older population of people with health problems that could suffer the worst disease and have the poor outcomes. So, especially this time of year when there's hay fever, allergies, it's very difficult to know. But usually it's fever, cough, and shortness of breath. And of course, there can be the body aches, the just not feeling well, fever. There's all kinds of symptoms with it.
Because of COVID-19, the clinic and the hospital are still open. We talked about this beforehand. It's pretty much, I don't want to say an emergency, but it's got to be somewhat severe for people to be coming in right now because of what's going on, correct?
Yes, correct. And we're trying to, it's probably for the last 3 weeks, we've been operating with about half staff. So, like, we have 4 providers, and there's just 2 of us working each day. And part of that is trying to prepare for the surge and also to limit patient contacts just with the off chance that either an employee or a patient could have COVID and is in that period where they are shedding the virus before they become symptomatic. And then part of that is just preparing because the volumes are so low and trying to realign staff to where they're needed and things. But yeah, right now, like I said, we have the respiratory clinic, which is a completely separate entrance, and the nurse and the provider you'll see there are in full like hazmat safety gear, and that's primarily for anybody who has any cough, any cold symptoms, any fever. They'll be seen through that clinic, and that is honestly here. It's pretty slow right now. It's averaging maybe 1 to 4 a day. And then the other part of the clinic, completely separate from that, through a separate entrance, is all of the more like urgent care or emergency things. we're trying to figure it out because it seems like this thing could last a long time. So we're trying to figure out how to live life and provide care with COVID. But as of right now, we are on a triage level where we would just encourage like urgent and emergent things to come in.
So one of the things that we've heard with COVID, and it's good practice, especially during flu season and everything like that, is the washing of the hands and using hand sanitizer and things like that. Can you explain to the people that might not understand the difference between, because I know people are like, oh, hand sanitizer, hand sanitizer, hand sanitizer. What's better? When should you do one? When should you do the other? That type of thing?
Yeah, that's a good question. Both are good. Hand washing, especially if you do it properly, where you soap lather up hands between fingers, around nails, up to the wrist, for at least 20 seconds. That does a little bit better of deep cleaning and getting the germs off the hands better. And I know everybody likes to use hand sanitizer because it's quick and easy, and it's okay. But especially if you're in a job where you're touching a lot of surfaces, or your hands are visibly soiled or dirty, of course the soap and water is the best.
So with summer coming and a limited aspect on the clinic, a few things are going to come up here as things go by that people might normally go to the doctor for, and maybe some things they can take care of at home. Just kind of a list of things that we've talked about here on Big Sioux Media that, growing up or raising 3 boys and Matt Larson raising 3 boys and you having 3 children, just kind of those things that go on. As kids get out and they get on their bikes, the importance of wearing a bike helmet to start with.
Oh yeah, especially as a small town doctor, you always get nervous when the weather gets nicer, because that's when people are getting out on their mopeds and their flip-flops and shorts and tank tops and no helmets, and they're getting out of bikes and skateboards and scooters and all of that, and it just you love this time of year, but whenever your phone goes off at like 7 o'clock at night, you just get a little nervous that it's somebody's kid that got some kind of injury. So yeah, it's the biggest cause of death in like school age children, like our age kids, is unintentional injury. And of course the number one is vehicle accidents, and then drowning, firearms, and falls. That injuries from falls are close behind that. And I know everybody can't ever imagine something happen, but yeah, the importance of bicycle helmets, proper use of seat belts. If you have little kids, making sure anybody under 8 and under 4'9" is in the right fitting booster seat. Anybody under 13 should be in the back seat. This time of year, kids love to ride in the back of pickups, and that always makes you cringe a little bit too whenever I see that. That's just an accident waiting to happen. And then lake and boating safety and swimming safety. Those are always. I can't tell you how important it is to use life jackets. You'll always hear of a handful of fatalities that possibly could have been prevented by using life jackets in South Dakota.
So then that leads us to some of the other things that goes on here during the summertime months. And then we'll talk about another big one that I think of, and you probably see a lot of too, are the kids that are getting cut because of either a bike accident or goofing around outside, hitting a stick or something like that. At what point does a parent have to worry about, okay, it's a cut, it's a scratch, time to go in to get stitches, especially if we're trying to limit to a triage type situation?
Yeah, that's always kind of hard too, but it depends a lot on where on the body it is. If it's like a small cut on the forearm or even on the face, if there's not much tension on the wound that's making it really like spread easily, and if it's not terribly long, like under a couple or under a centimeter and a half or so, and it doesn't spread very easily, usually you can just leave it be and cover it with a Band-Aid, and it'll settle down. And the same thing, like with the ones on the extremities, it all depends on how much tension there is on it. If it's like over a joint and you move the joint and it gaps, then it's probably going to need stitches. If the kid moves the arm or the wrist or the hand and it doesn't seem like it gaps very much and it's not bleeding very much, then it's probably something that can be covered with a Band-Aid and it'll scar just the same as if we put stitches in it. The one thing that probably is something that you might have to see somebody for would be a bite wound, like especially cats. Cats are they're right behind humans as far as nastiness of bite wounds. So usually we'd have to see those and get them really really well, like human wounds, especially irrigated out. And cat bites may not seem like much at first, but they tend to get infected really, really easy. So while you wouldn't need to probably stitch a cat bite, you just got to keep a close eye on it and most likely get antibiotics. Dogs, those are a little bit bigger bites, and most, that brings up another point, tetanus, especially with like fishing hooks, scrapes. Most kids get a tetanus booster at 5 and then another one at 6th grade. So most of the time kids are good if they're up to date on their immunizations. Us adults, we don't get those very often. So probably the last time most of us had one was either in middle school or possibly when we were at college. So that's one thing where you could just, and at this time, we're just doing like drive-by vaccinations. If we know somebody's fine, we'll come out to the car and give it to them there if they need something, so they don't even have to get out of the car. So,
as the sun has come out now recently and things are warmed up, people are outside, people are doing yard work and things like that. Even in this early spring, that sun is kind of powerful. I was out today, there was a lot of heat today. People don't think about it, but you can easily get burned here early on in the spring. What's the best way to handle a sunburn?
Best way is to try to prevent it. We're all pale from being inside for 6 months. So, the best thing to do, especially even for kids, because a lot of the older people that I see that have the skin cancers, that sun damage happened when they were teenagers and young adults. So stressing the importance of sunscreen and using at least SPF 15 or higher for sunburns. The main thing is just pain control, Tylenol, ibuprofen, staying hydrated, and then aloe products can be a little soothing. It's probably the best treatment.
Which brings us to another type of burn. A lot of people probably got the grills going here over the weekend, or the smokers or whatever. And the ones that blister are the ones that are really the concern. You see a blister, it's uncomfortable, you want to pop it, but that's not the right thing to do, is it?
Right. Yeah, we really try to leave those in place. And the burns that are concerning, and sometimes you look at burn and not think that it's really that big of a deal, but any burns on the hands, just with with as much motion as there is an entire hand over the joints and things. Any burn on the hand, if it's beyond just a small superficial burn, is something that you should have somebody take a look at. Burns, of course, on the face, ears, and any larger blistering burn, you just need to have somebody take a look at. For most of the smaller ones, bacitracin or neosporin, that's safe on any part of your body, face, hands, arms, legs, doesn't matter. But yeah, for some of the bigger burns, there are some burn creams that can help a little bit with the pain too. That is another significant problem in summer as well.
One other significant problem, and we're not having it yet, but June and July are coming, and that's the difference between a heat exhaustion and a heat stroke. When people are outside, and being able to stay hydrated and know when the body temperature is getting too hot, and the proper way to cool it down.
Yeah, the biggest thing is, like you said, just paying attention to your body. Typically with heat exhaustion, you'll just be feeling a little bit of fatigue, maybe some dizziness. You'll still be sweating, but you can have like lightheadedness, dizziness, things like that. With heat stroke, it's more severe. Your actual body temperature goes up. You stop sweating. You can get even a little bit delirious and confused, and that's a pretty significant emergency that you need to cool yourself down right away with. And that's something you generally come to the ER for with just heat exhaustion. Usually, just moving yourself to a cooler place. Hydrating and just resting is the main thing. But once that's happened, you're gonna have trouble the rest of the summer with the heat. So just trying to just pay attention and stay hydrated when even if it's like 80 degrees with the humidities like 85, 90 degrees, sometimes that is even enough to push people to heat exhaustion and heat strokes. You just have to be careful and get in the shade when you can, stay hydrated, take breaks, and that's when I go outside now. I grew up on a farm, but yeah, when I go outside now in the summer and I'm out there for any length of time, I'm like, jeez, I couldn't be a farmer. I'm totally soft now.
So hopefully at some point we're going to have a summer sports season. You know, we're going to get some baseball and softball and hopefully get some basketball in and things like that. So just a few quick sports things we want to talk about. The sprained ankles, twisted knees, things like that. What's the proper way to take care of those? Elevation, ice, that type of thing.
I'm a bad parent. Don't ask me. I made my son walk around on his foot for 2.5 months before I decided to take him in after basketball season, and he's been on crutches for the last 5 weeks, not putting any weight on it. But yeah, I think the main thing is a lot has to do with the mechanism of injury. If it's like especially with knees, if it's a sudden stop or twisting and pretty significant onset of pain right away, then that would be something we're concerned about. Ankles are tricky because sometimes a subtle injury, you'll especially in kids with growth plates and things, it can result in a fracture. But I think the main thing is just like I was asking my son, are you hurt or are you injured? Just knowing trying to get familiar with your kid and knowing if this is out of character for them. If it's just a mild pain, usually ice it, ibuprofen, Tylenol, and give it a couple of days. And if it is still staying considerably tender, then checking it out. Or if, especially on ankles, usually like a bony injury is pretty tender on the bone, and I know it's complicated because there's all kinds of ligaments pretty close to bone and things too, but swelling, and if they're really having difficulty ambulating, and if there's tenderness on the bone, then they should come in for x-rays.
The other thing that we think about, and we're going to go back to adults a little bit, and kids for an extent too, people are cleaning out the yards, cleaning out the gardens, cleaning out the garages, and sometimes it's like, oh, I can move that box, that's not a problem, and I can move that, and you don't feel it until about 2 or 3 days later. The difference between using heat and using ice, when to use which one, benefits to both.
The first 48 hours of a muscle injury, ice is the best. It just helps more with the inflammation that's going on in the joint or the muscle. Okay. And then after that, especially with back or neck injuries where it's more like the muscle spasm and tightness and things, heat is probably better for that. Like with joint injuries, knees, ankles, shoulders, most of the time it would be ice throughout the whole course of things. Heat's not really too beneficial for those things, but heat for lower back, neck type things, that sometimes help loosen up those muscle spasms a bit.
So we're going to finish this up. I just got one more question for you, and just kind of a recap of what we said earlier. When we talk about when to come in and when not to come in, especially right now during COVID, what type of pain scale, what type of symptoms are you guys recommending? First of all, should they call in first? Do they stop in first? What's the best practice right now?
The best practice would be to probably call in first, and especially we got a little advantage in a small town. We know most of our patients pretty well, so if we know that something is out of character for a patient, we know if it can just be treated over the phone, or if we need to see him, or if we need labs or x-rays. So the best thing is to start with is just to call your provider. And it seems like, and I know it's going to probably change here, but there's been enough time that we've been sitting kind of twiddling our thumbs, so we're looking for things to do a lot of the time. So we don't mind those calls, and we'd much prefer those calls rather than having you come to the clinic for something you could have taken care of over the phone. And I know we're doing, if it's something minor that we can check out via video like this, we're doing video visits now. So a lot of those things that are able to be done this way, we can do that too. So, but yeah, the biggest thing is just I feel like just knowing my patients and knowing what's going on and what's out of character for them is the biggest help. But as for you as a patient, I think, and I know there's a lot of anxiety and worry and things, but if it's just something where you feel like this isn't right, or this belly pain is more than indigestion, or my chest is hurting, just call and talk to somebody, and we will be able to triage you safely without increasing any risk of anybody contracting any infection.
That is great advice. We want to thank you, Dr. Herbert, for taking some time here on this night to go through some of this stuff. We were talking earlier, you and I were supposed to be in Omaha this weekend watching some basketball. So tell Max to get a speedy recovery, and tell your other two children Gus and Emmy, hi from us here at Big Sioux Media, and we appreciate you taking time out tonight to do this video with us.
That's been fun.
All right.
Hopefully we'll see you guys in the baseball before the end of the summer.
Yes, we're hoping so too. That is Dr. Matt Herber. My name is Lee Palmer for Big Sioux Media. We want to thank Matt Larson doing the technical stuff behind the scenes. And check us out next week for our next guest on the people of Dell Rapids.